is Leonard Kish with HealthIT TV. I'm here with Lygeia Ricciardi, a consumer engagement expert here at HIM16. You're here talking about mHealth and its relationship to patient engagement this afternoon. Tell us a little bit about what you're going to discuss and what your big topics are that you're looking at and wanting to learn about at HIMSS this year.
Sure. Well, I'm going to be talking about mHealth apps, as you said, and I'm going to start off by kind of stepping back and looking at the big picture. A lot of people talk about mHealth and they're really excited about it, and I'm certainly somebody who's been a proponent of supporting mHealth apps and other creative and innovative uses of technology to engage consumers in their health. But you have to realize that we are of really adopting and appreciating these technologies out there and or why isn't it working better, or what's up with that. You have to sort of understand that still only about 17% of people are using mHealth apps anyway.
Right.
And many of those are using them primarily for finding information. So when you look at, or for getting information. So for example, getting a text program that says, don't forget to have this checkup or get that shot or get that test done, that kind of thing. I think as we look into the future further and where these apps will start to be, there are many reasons that will drive their greater adoption, but when they become more successful and more exciting, they'll be a lot more interactive, and hopefully we'll use some of our own clinical data and medical records more than they do to the current extent. Right now, a lot of apps and certainly wearables are based on data that the individual consumer or patient enters on their own, as you know, and that's somewhat
often
limited.
A big hurdle.
Yeah.
That, like a lot of the early PHRs were, more work for the user to do to start managing their information, and most people don't really want more work to do. They want value that comes out of it.
Yeah, and even if you, and I know as a veteran, if you sit down and you do all that work even once, it's not updated. Who knows you're going to be updated, are you really going to be motivated to do that 3 years later when your child is sick? Probably not.
Right. And it seems like there's the way sensors are being commoditized, it seems like a lot of clinical primary care physician for now are going to be in 5 to 10 years, probably not an unreasonable estimate. Kind of one side of the equation, but then there's the behavioral aspect and or other not. Are people really going to be driven to do those kinds of things as well?
Well, here's the thing. Apps are also going to get a lot richer, just as our data sources are going to get richer. I mean, let's start by just trying to get our data from our EHRs. As a start, let's go there. But I hope that, like you, I hope that in the next, 5 to 10 years, you'll be able to collect a lot of that data, not just from your traditional doctor's record, but from other sensors and devices in your environment or on your body or in your body. And at that time, we're not just going to be using a simple app on our phone either. Like, apps are also going to be more aware of your surroundings and prompting you to do things based on where you are and what you're doing. Say you're doing, because a lot of apps are around exercise right now, you're getting tired. It's more like you could just keep going that extra mile. What you want is really fine-tuned advice that and guidance that longer term self. I was gonna say their better term self wants them to do or be.
Right.
Like, we all want to be healthier and be well, and yet it's so tempting in the immediate term to eat ice cream instead.
Right.
So, balancing those things, but keeping in mind your real environment and injecting you with motivation at the decision points when you really need them.
And there's the other gap I see is that physicians, of course, we were talking about a little bit earlier, aren't really involved in a lot of the apps right now. They're not playing that consulting role.
Right.
Are you hopeful that there's going to be more of that? You see even a lot of the premier telemedicine companies really aren't doing a lot with at-home sensors or remote monitoring.
Yeah. So this is
that going to change?
You're bringing up a good question. Yeah. So again, one of the problems with these apps is that they're too disconnected from the rest of your life and your health life. And I'll be co-presenting with Dr. Jen Dyer. She's a provider who has developed an app to help her patients. She's an endocrinologist, so she helps them manage diabetes. And I mean, not that every provider has to go out and build their own app. It'd be great if they did, but certainly
but
not
real world
necessary.
Use cases,
but the point is, she is involved. She's not, I mean, recommending an app is great. Building one, obviously, she's super committed. But surveys show that people trust their provider more than anyone else in the health system. And if a real sense of urgency comes from that provider, I shouldn't say even urgency, maybe in some cases, but a real invitation to engage more fully in health and wellness through technology comes from that person, you're going to be more likely to actually not only use an app, but to stay with it over time.
Are payments going to have to shift for that to happen?
Absolutely they are, yes. I mean, often at the bottom of our conversations is issues around payment reform, of course, and how the money flows. And there have to be incentives, including money, but not limited only to money, certainly for providers to engage patients more, and also for patients to be more engaged in their health. And when I say incentives, some may be financial, but others may be a sense of gratification, a sense of being part of a group, down your best friend who you also promised you would, stop smoking with or whatever.
Well, that kind of leads to peer-to-peer healthcare, which Dave Chase and I asked you to write a piece that we'll be releasing in a month or two about that involves peer-to-peer healthcare and the future of peer-to-peer healthcare. And peer-to-peer is, things like patients like me, where people form a community and share information and tips for how things can be done together to improve health. And what are you seeing there as far as the future?
So I think that's one of the more interesting and exciting areas for growth. I think that you shouldn't think of it as an either or. I don't see peer-to-peer healthcare in conflict with getting information from your provider or other members of a traditional health team, but it can expand and augment it. And sometimes it may actually encourage you to go find another provider or do something other that was recommended. So it can be in conflict.
The Yelp-like.
Well, or, you might learn from other people who have a condition similar to yours about, something might be different in your diagnosis, or they might suggest a treatment that they have tried that's different from what your provider suggests. And in that case, I don't think that you should have this pure allegiance to your provider and you're not somehow being a bad that info from all these people who've tried it. Ultimately, you as the patient or caregiver for someone else, you make the choice, but learn from all the sources that you can. Other peers and also your own, primary care physician or whatever other professionals you're seeking info from.
And, unfortunately, a lot of people are being pushed in that direction with high deductibles. We hear stories every day. So do you see that might kind of push people towards
where they're
looking for other avenues of...
So,
I mean, you still have to go to your doctor to get certain kinds of tests. That may change.
Right.
You have to go to your doctor to get medicine and diagnosis, but...
So when I look at high deductibles, there's obviously a risk and a promise. The risk is that people will simply avoid care because they can't afford it or prefer not to pay for it. The promise, however, particularly on a macro scale, is that people are going to start doing more homework about what they're paying for different services and the quality of what they're going to get out of things, because ultimately they're more invested in their own care. So that's one way to think about it, but I get that on a more immediate level, do I want to pay this huge amount for this, that, or the other? That can be discouraging, in which case I do think the internet and sources of other sources of information like peers can help to support people and help them figure out when they need to spend that dollar, those extra dollars to invest. Hopefully, though, it'll also drive things like prevention and, I know that's the longer shot, but this is, again, back to your question about mHealth apps. Like if you sort of sit down and you think about people's long-term goals about being healthy, saving money, and so on, and you develop apps and tools that nudge people and help them in small ways to work toward those goals, hopefully you avoid a lot more of the sort of critical scenarios.
All right, well, thanks a lot. Thanks for talking with us appropriately in front of the lunch line at HIM 16.
With a fair amount of fruit and
with
some
a fair
quinoa,
amount of fruit, yes.
which
That's
is
done
good.
a better job than a lot of conferences do. So thanks. This is Leonard Kish with HealthIT TV with Lygeia Ricciardi. Thanks.